Okay, I hope doesn't go on for too long. I did cancer. I can't give you um medical advice, but I can tell you what I did and what I didn't do. So I'll be perfectly honest. I did cut out sugar and all that. I break it sometimes now, which I spilled it on myself. Here's the thing. Um, I was eating really badly under a lot of stress. Um, and I started getting pains in my side. So I went to the doctor and I said, yeah, it's in my kidneys. Did a sonogram, all of this, did a blood test. Doctor calls me back and says, your white blood cell count is high. Go see this oncologist. So this is like 2 years ago around Christmas. These doctors tend to take vacation at the same time. So took time to see the guy. So I saw him. He wants to do other tests. I go back to see him and he's like, meets me outside. He's freaking out. He's like, it could be cancer. I want you to go to the hospital. And I'm going like yesterday's clothes. I don't have my phone charger with me, all of this stuff. So I'm going to walk up to the hospital right up the block. He's like, no, no, I'll call you an ambulance. But it turns out that my primary was affiliated with a hospital called Maimonides, which went out of business to fit. Anyway, I get there. First thing I know, it's off because you see a Hasidim in the emergency room breaking one of the administrators' chops over costs. You see a Hasidim in the hospital or a bank, leave. Never go back. Because you know they're cheating. I mean, that's just the way it is. That's not being anti-Semitic. That's what I observed. And I don't do business with them. I have nothing against them. I don't do business with them. So anyway, go through the whole thing. They do an MRI. They're going to do a colostomy and change their mind. Come up to me and say, you got a tumor. You got to cut out a foot of your colon. And I said, wait, I almost did it. The next day I said, wait a minute. Am I going to have to wear a colostomy bag? The surgeon said, yes. I said, for how long? She said, maybe a year. I said, you weren't going to tell me? So I said, no. Now here's where it gets very tricky. They didn't want to let me go. I had to tell them I want to go home, pay bills, take care of things. I met with four old surgeons and they said, oh, that's rational. Oh, you can go. One thing you have to notice when you go to the hospital, they used to have a patient's bill of rights. They still have it now. In the packet they give you, they changed it. It used to be you should um, listen to your doctor's recommendation. Now it's kind of word of that, like since COVID, they could keep you there. So be a little careful. So anyway, I went home. They gave me a drain because I had this infection in my I forget the gland. It's a cancer that kills you. Anyway, again, they're on vacation. So I go to a guy to get a colostomy. And I get there and he looks at my chart. He goes, we'll come back in 3 months. You don't have cancer. You have, see, I can't think of the thing. I can't think of it. It's when little pockets develop in your intestine, become infected, and they hurt. So anyway, one thing leads to another. Uh, I was bleeding out inside. I went to the hospital. They wanted to operate. I didn't even want a colostomy at this point because I heard with spread cancer. I had heard. But anyway, I did not want a colostomy bag, but I got my father died that way. Didn't have cancer. He was misdiagnosed. So they put me under, go to do the procedure. I wake up with a colostomy bag, and they tell me they didn't do the procedure because it had moved into the wall of the intestine. It was too big to take out, and I was in too weak in a state. So I'm like, how am I going to get this thing out of me? So you got to go for chemo. I almost did it only to get this thing out of me. I prayed, I meditated, I tried to do manifesting. I go back to meet with the surgeon. I didn't meet with her. I met with this new oncologist who wasn't supposed to be there. With Matt, I'd switched to him. He was sitting like this, leaning forward, exactly as I had pictured him. I had hoped he'd say, "Go home, you're cured." He said, "You're." Tumor has a genetic anomaly, so we can try what they call immunotherapy. It basically jacks up your white blood cells. So we did that treatment. I think it was every month, every 5, 6 weeks, something like that. In the meantime, my cousin sent me all of these different supplements. I'll show you in another video. Um, I changed my diet, no sugar, no carbs, high fat. Uh, this is Dr. Friedman, I think his name is, on YouTube from Boston University, who does these studies. I'm convinced that was partly what saved me. The other thing that saved me largely was I never went in thinking, people with little stickers saying I beat cancer in 5 years. Now I'm done with it. However, when I went for the surgery, they took out the tumor, part of the muscle in my side, part of my diaphragm because they said it spread, and a chunk of my liver. I'd agreed to the liver and the other, not to the other two. Um, but I feel fine. I'm doing okay. I break my diet sometime. Um, I eat a lot more than I used to. I was like this from all of this. They want me to go back for a colostomy in 2 months. I'm debating whether to go. Again, I can't give you medical advice. But I have feared chemo and doctors all my life because my father was misdiagnosed. I'm sorry, he had diverticulitis. They told him it was cancer. They let them operate. Infection ensued. He died months later in the autopsy. No one ever told me this. My aunt told me years later, his sister, whom we didn't see too much. So I didn't want any of that stuff. Um, if I had it to do over again, I would have just prayed, fasted, changed my diet, not even gone. That's how I am now. Um, but so far, so good. But I would never do chemo. First of all, they lie. 2 weeks, 3 weeks, 4 weeks, 6 weeks. They lie about the complications, damages your immune system, all of this. Now, something again I learned from my cousin. I have a cousin who's a retired social worker in the hospital. They're the people who liaison between the insurance company and the hospital, make sure the hospital gets paid. I don't think he gave me the best advice. He advised me to take the operation. However, I had him as my medical advocate and I mentioned him to the doctors. Once I did that, they treated me completely differently because they're afraid of being sued. So always have some type of medical advocate, even if it's your mom, lie and say she's a nurse. So, yeah, it doesn't matter. Make sure they never think you're alone. And if they come up to you after you've been in the ER or something and say you have to have this surgery. Say, no, I have to talk to my family member. I have to get some consultation. Even if you leave and come back, don't ever let them say, you have cancer, you get scared, and they cut you open. I'm not going to kill you in a month. Take your time, get your best option. My cousin nursed her parents through two separate bouts of cancer, not using chemo, mostly using natural things like black seed oil, red pepper, what have you. There's a Fred Benini, I think his name is, has a clinic in New York who kills cancer, he claims, with ultrasound. My uncle, who did a lot of research, claimed afterward that's what he would have preferred doing. Again, I have to leave that up to you. But be very careful of the hospital too. I don't know why Maimonides closed, but they had a pretty bad reputation for a very long time. My guardian angel must have been, you better pray too. I don't care if you're religious. Even if you're not religious, it changes your mind. If you don't want to pray or pray or meditate, meditate. Do a lot of it. People like Abraham Hicks, uh, Wayne Dyer, Joe Dispenza, they themselves might be con artists because they're selling you something, but what they're selling you, I mean, like retreats and stuff, but what they're selling you work not 100% of the time but I can assure you that it works to some extent. And it wouldn't hurt you to do it. The worst thing you can do, which I've seen people who died of cancer do, is think of your body as simply a machine. You put a medicine, the medicine cures you, you go home. You're more than that. You're spiritual, you're emotional. All these things have an effect on how your health is going to be. So, uh, if you have any questions, please put them in the comments. I'd be glad to answer anything you might ask. Oh yeah, one thing I got very lucky. Some reason my local hospital had been bought by New York Presbyterian, which owns part of the conglomerate that owns Sloan Kettering. So when they sent me for my operation, they sent me there. By some strange magic, I got my own room with like two glass windows facing the river. It's like up on the way. It's like 68th Street or so, way on the east side. How I got that, um, I don't know. Um, the other thing is, you'll have to notice doctors will always lie or try to lead you into saying what they want you to hear. So, for example, they ask you a questionnaire, did you ever do illegal drugs? You get the same questionnaire like 5 times, trying to catch you in a lie, I suppose. Everything is geared not for them to get sued, you know? So finally, there was a humorless Hispanic woman. Have you ever done uh, illegal drugs? I said, no, but I'm looking into it. I thought that was very funny, but she just looked at me like, why would you say that? And I had to explain to her that it was a joke, but problem enough. Um, with that much said, I had no worries. I started exercising a little bit. I used to row a lot, like rowing machine, just a little lifting, little sit-ups. It does give me pain. Oh, luckily too, when they did the operation, they did it laparoscopically, so I'd have to get slapped open. They just put a little hole in you. But the weird thing is they sew that one up, and when they put a drain in you, because I had an infection, they let it shut by itself. Like the special sutures a doctor has to take out, special doctor, not just not any doctor. And mine pulled loose. So it was like, "Root, root." So I told him that, and it's still been leaking all this pus like on and on, like week after week. The nurse just said, okay, here, take it out. And she just, I don't even think they put a bandage on it. They just let it heal by itself. I think maybe there was a bandage for a few days. But so you end up with like two dimples, and this side of me is sticking out. I I looked online. They say sometimes it heals, sometimes it doesn't. I'm going to ask. It's very sore now. Uh, my my surgeon about it. And then I see them in a couple of weeks. But one thing I would do, reduce stress, stop all the sugar. Dr. Friedman's advice is that cancer chiefly eats glucose, um, that crap in wheat everybody's afraid of, and there's another protein that you can't really get out of your diet because and everything. But the diet I followed with him was like 80% fat. I know people worry about heart attacks, but 80% fat, like 20, 30% protein, low calorie. Now I'm not sticking to it crazy, but again, people would give me all of these natural cures. My cousin sent me all of these vitamins. I take them. I don't think about it. You got to take 5 a day for it. I put them in a blender. I get to it. I don't get to it. And at some point I said, no, no more cures. No more cures. I'm just not doing it. So that's that. I hope this is helpful and talk to you soon.